Have you ever walked into a greenhouse? It's warm, humid, full of life. Literally the perfect place for things to grow, even when they shouldn't. Well, fungal infections operate in a similar way. They don't grow because the fungus is really strong. They grow because the environment is perfect for growth. Students often miss this because they focus in on the organism rather than the environment and conditions that make it grow well. Well, today we're going to focus in on the risk before the infection ever has a chance to appear. Here's your clinical judgment principle for today. Risk environments predict fungal infections long before the symptoms do. But fungal infections are slow, opportunistic, and they love environments that are warm and moist and just prime for growth. They also thrive when people have impaired defenses. Let's start off with 3 high-yield facts. First of all, fungi love warm, moist, dark environments, just like the corners of a greenhouse. They also can really take hold when barriers are compromised, such as skin folds, mucous membranes, lines, and catheters. And they also thrive when immunity is low, such as in steroid use, diabetes, antibiotic use, or neutropenic precautions. Here's a 3-part framework that you can use, almost like a sign: best conditions for growth, warmth, moisture, and impaired defenses. If all 3 of these are present, your risk for fungal infections skyrockets. And it's your job to identify these ideal greenhouse conditions before fungal infections ever have a chance to grow. Let's connect this to clinical judgment. We said that the risk for fungal infections is the environment, and it happens long before any symptoms do. So this is a great time to step back and pause and ask a few really important questions. So we start off by asking, what kind of conditions is this patient experiencing? We move on to asking what's going on in the environment. And lastly, we zone in on asking ourselves the question, is this a great place for fungi to grow? This pattern recognition is part of prevention, reduction of risk, and we're not treating it yet. We're trying to prevent it from ever growing in the first place. As nurses, we want to zone in on the cues that tell us that a problem might be brewing. For starters, we're going to be looking at skin folds under the breast, in the groin, or even under an abdominal pannus, where moisture tends to gather. Next, we're going to be looking for people who sweat easily or have limited mobility, because those are conditions where moisture and warmth are, and fungal infections can grow there too. Next, we want to see if they've had recent use of broad-spectrum antibiotics, because if so, that might have wiped out a lot of normal flora that can prevent infections in the first place. We also want to take a look at seeing if they were on high-dose steroids or if they have diabetes, which is another place where high sugars can tend to promote growth. We also don't want to forget about devices or things that we might put on a patient that can promote growth as well, such as oxygen tubing or dressings or even incontinent pads. And if we notice these cues, this is our signal that an intervention is needed. So we want to take action now. All right, now we're ready for our interventions, which nurses tend to love. We're going to keep all skin folds dry. We are going to use moisture wicking barrier devices when possible. That's the ones that pull the moisture away from the body. We're going to monitor the patient closely for any kind of fever or rashes that might be developing. Sometimes it might be appropriate to remove devices or change the position of them to give that skin area a break. And we want to advocate for antifungal medications when it becomes appropriate. So just like in a greenhouse, you're monitoring for problems before the overgrowth becomes unmanageable and hard to take care of. You're starting to realize that prevention isn't luck. There's science to it. You're identifying risk before it becomes a problem, and this is clinical judgment at its core. All right, here's a great 1-sentence summary. Fungal infections are prevented when you identify the environment and conditions in which they best grow. If you enjoy these clinical judgment videos, Be sure to come back again next time where we'll be covering G for gallbladder disease. Hope to see you there.